Good afternoon, everyone. Thank you for joining us this afternoon, February the 22nd, for our media advisory. I'd like to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Jason Thorne, our Emergency Operations Center Director. And as you know, the province has recently made a series of announcements about easing public health measures across Ontario, which is great news for our local businesses and for us as a municipality. In alignment with the province announcements, we're also turning our attention towards the reopening of city facilities and resuming more regular delivery of in-person city services and programs. So beginning next month, we're starting to return many of our staff who have been working from home during the pandemic to the workplace. This is an excellent sign of recovery for us as an organization. Jason will share more about the return to work plans in his briefing. And Jason will also talk about the proof of vaccine requirements for city facilities. Currently, residents are required to provide proof of vaccine to enter certain city facilities, including our recreation centers and museums. These requirements will be lifted in alignment with the province's announcement as well. So as an organization, we've been working hard to ensure our facilities and municipal spaces are following all of the established health and safety measures, so we are able to protect those working in our workplaces or visiting to access city services in person. And as we begin to welcome more residents and staff back into our workspaces, we will continue to see familiar public health and safety measures in place, including physical distancing requirements, masking inside public spaces, and enhanced sanitation and more. So staff working in municipal spaces will continue to do their daily health screening and continue to be subject to the city's mandatory COVID-19 vaccination verification policy. I have full confidence in this work and support this work as well to prepare and welcome our employees back to the workplace and offer more in-person services for our residents. And with that information, I'll now turn it over to Jason Thorne, our Emergency Operations Center, for some citywide updates. Jason?
Thank you very much, Mr. Mayor. And as the mayor noted, and as members of the public will know, last week, starting on February 17th, a number of changes took effect as a result of the easing of the province's public health measures. So these included things like increasing social gathering limits to 50 people indoors and 100 outdoors, increasing organized public event limits to 50 people indoors with no limit outdoors, removing the capacity limits in a number of indoor public settings where proof of vaccination is required. So that's things like restaurants, bars, gyms, cinemas, meeting and event spaces, allowing 50% of the usual seating capacity at sports arenas and concert venues, and maintaining or increasing capacity limits in other indoor public settings, such as stores and shopping malls, to the number of people who can maintain 2 meters of physical distance. So with respect to city services, what that meant was that our arenas and rec centers that had been operating at 50% capacity began operating and opening at full capacity last week. And as the mayor noted, last week the province also indicated their intention to further lift some of the capacity limits in remaining indoor public settings and lift the proof of vaccination requirements for all public settings where it is still currently required. The province is planning to take these additional steps on March 1st if public health and health system indicators continue to improve. So in alignment with the province, the city is preparing to similarly lift the proof of vaccination requirements for members of the public who are attending our recreation centers, arenas, museums, and other facilities where proof of vaccine is currently required. However, I would remind the public that for now, these vaccine requirements will still remain in place. As I said, we anticipate that the requirement will be changing March 1st. But as I said, that's pending the province's decision on the provincial proof of vaccination requirements. So the public should continue to expect that proof of vaccine will be required at our city facilities for now. And we do ask the public to remain patient and to please remain respectful of the city staff at these facilities who are responsible for ensuring adherence to these requirements. Lastly, as the mayor indicated, I'd also provide a bit of an update with respect to the return to the workplace for a number of our city staff who are currently working remotely. So for those staff, they'll begin transitioning back to the workplace in a phased and gradual return beginning the week of March the 21st. The first group of staff to return to the workplace will be our senior leaders. So that's directors and general managers. And then all remaining staff across the organization who are currently working from home will commence a phased return to the workplace starting on April 4th. under their approved working models. And we expect that that phased return will take place over the course of about 6 weeks. Now, this only relates to the return of staff to the workplace. So just a reminder that at this time, only the first floor of City Hall, as well as our municipal service centers, are open to the public to access municipal service counters. We've not yet set a date for the reopening of some of the other City Hall counters to the public. So with that update, I will turn things over to Dr. Richardson.
Thanks very much, Jason. Good afternoon, everybody. So we do continue to see improvements in our key COVID-19 health indicators here in Hamilton. We continue to see a decreasing trend in percent positivity of those being tested by PCR, as well as decreases in new hospitalizations and ICU admissions for COVID-19 cases that are reported to Hamilton Public Health each day. Locally, there are 2 new hospital admissions each day on average and less than 1 new ICU admission per day. Despite these decreases, our hospital partners do continue to report strain on their services due to the ongoing staffing and occupancy pressures. Although they are decreasing, that strain is decreasing as well as these numbers improve. The average number of deaths per day does continue to be significant, but it is decreasing overall. Today, Hamilton reported 6 additional COVID-19 related deaths since Friday, February 18th. Our rate of percent positivity is sitting at 12.1%, which is very much in line with the provincial rate. And our rate was previously 14.6% on February 8th and 14.1% on February 1st. And just a reminder, that's amongst the PCR tests that have been completed. In addition, the number of active outbreaks has been consistently decreasing in recent weeks. There are now just 7 active outbreaks, with 1 new one being reported today and 3 outbreaks being declared over since Friday. Details about the outbreaks can, of course, be found on our COVID-19 dashboard. We are cautiously optimistic about the province's planned easing of public health measures across Ontario in the weeks ahead, knowing that we need to balance the risk of COVID-19 and the mental health and social connection and other needs economically of our residents. While Hamilton is past the peak and in the decline of this Omicron-driven wave, we do anticipate that the risk of transmission will remain high through March as measures are lifted. The Omicron surge and the significant number of associated infections this winter, along with high immunization rates across our community, means we will have a strong line of defense as we reopen. Collectively, we've learned a lot and have a number of tools now to protect ourselves and one another as we transition and continue to learn to live with COVID-19. We have safe and effective COVID-19 vaccines. We now have safe and effective treatments that can be taken both inside the hospital or as an outpatient through our local hospitals, along with, of course, continuing some of our well-established public health measures that will continue to be needed in the weeks ahead and may be called on again locally and potentially provincially down the road if conditions require it. With our community and the rest of Ontario gradually reopening and the planned easing of restrictions over the coming weeks, I do encourage people to take the necessary steps to live with COVID-19 to prevent the spread of the virus and reduce the pressure on our healthcare system. So continuing to get fully vaccinated, and that means getting your 3rd booster dose when you're eligible. Data shows that vaccination, including getting a 3rd dose, provides strong protection against serious illness and hospitalization. In addition, we should continue to follow the well-established measures such as wearing a well-fitting mask properly, maintaining physical distance, being mindful of your number of contacts, and staying home when you're unwell. And with all of that in mind, individuals do need to complete their own personal assessment of their own risk as it relates to their comfort and safety in community settings. So just turning to our vaccine program, our top priority, of course, continues to be the opportunistic and hyper-localized strategy that we've been taking to administer 1st, 2nd, and 3rd doses of our COVID-19 vaccines. And by doing that, we make sure that we have equal distribution, equal access to the vaccines for our local populations across our community and in neighborhoods and school communities with lower vaccine coverage rates. Overall, as a city, 87.2% of Hamiltonians 5 years and up have received a vaccine to date, and 83.1% are fully vaccinated. 51% of children 5 to 11 years of age have received a 1st dose of COVID-19 vaccine, and now 27.9% are fully vaccinated as well. We've been encouraged by the uptake of our local school communities with 1,470 COVID-19 vaccine doses administered through the school-based clinics that we've been doing since January the 28th. Finally, for third doses, over 282,000 people have now gotten their booster dose, meaning that 55.7% of our population 18 and over has a third dose, and 52% of our population 12 and over now has a third dose. As you know, residents aged 12 to 17 also became eligible for those booster doses on Friday, and we've had 1,257 Hamilton residents ages 12 to 17 take us up on that between Friday and Monday. So very good uptake over the weekend. 4,469 eligible community members have received their fourth doses. Hamilton Public Health Services mobile vaccine clinics will continue to visit local retirement homes this week with the plan to completing the administration of fourth doses in these settings. So through our last mile strategy, there continues to be a wide variety of clinic options that are available for Hamiltonians to get their vaccines. These are at our large fixed site vaccine clinic at Lime Ridge, our primary care-led clinics, our school-based clinics, our neighborhood pharmacy and community partner-led clinics, and through Ministry of Health-led GoVax, as well as mobile pop-up vaccination clinics. Community members can, of course, find out more information about eligibility, available locations, hours of operation, and how to book a vaccine at www.hamilton.ca/getyourvaccine. So we'll continue to build on this progress over the weeks ahead. We've brought forward a whole of community response right from the start of this pandemic, and each of us in Hamilton should be very proud of how we continue to come together to protect one another, including those most vulnerable and our healthcare system. We're very grateful for the community's commitment to each other, and together with the many tools in our toolbox we have and we will continue to learn how to live as safely as possible with this virus and get back to a more usual life, doing all the activities we enjoy at home, at work, and in the community. With that, over to you, Mr. Mayor.
Thank you very much, Doctor. Thank you, Jason Thorne, as well. And as you are now well aware, more businesses, facilities, and programs are opening up, and we must continue to follow the public health guidelines. And remember that getting the vaccine and the booster dose is the best way to protect yourself and your loved ones against this virus. So I want to thank our ongoing staff that continue to provide the vaccinations throughout our community and in our schools. And the good news is the numbers continue to go up, and that's a positive thing. We could have more people taking on the booster shot, and hopefully we'll continue to encourage people to get that as soon as possible. I want to thank our recreation staff that have been doing everything they can to adjust their programming for our Hamilton youth. And in light of the unpredictable elements that have come with the pandemic, staff have done their best to ensure safe access to activities are made available wherever possible. So we know that the pandemic has been difficult for many families in our community. And we thank them for your effort and the challenge of getting through this collectively. Let me also take a moment to share a great program where the HSR and the Hamilton Public Library have teamed up to launch a free Presto card for children ages 6 to 12. Parents and guardians can visit any Hamilton Public Library branch to register for a free Presto card. The card allows children to ride free on the HSR until April the 30th, 2023. So there's one per child while supplies last. So get to the library and register for a free Presto card. It's a great pilot program, generously funded by the Hamilton Community Foundation and an anonymous donor. So we thank them for their generosity, and certainly that provides more flexibility and opportunity for kids to ride free in our transit system up into April the 30th, 2023, only more than a year from now. By offering these rides with Presto, we are providing that affordable transportation, and families can explore everything our city has to offer using our great HSR. So visit hpl.ca/bus card for full details. And now Jasmine Graham is here to marshal us through any questions the media might have. Jasmine.
Thank you, Mr. Mayor. We have 3 media joining us today, and as usual, we will start with 1 question and 1 follow-up for everyone. First question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi, thanks very much. I hope you can hear me okay. So we've heard from Dr. Kieran Moore last week that he said he would look at potentially revising the provincial mask mandate sometime next month. I'm just wondering where Hamilton's Emergency Operations Center, kind of everyone, Dr. Richardson, the mayor, and Jason, where you stand on the local mask situation. Will our bylaw will be revised anytime soon? What are your thoughts on that? Sorry, I guess we'll go Dr. Richardson first or something, or Jason was talking.
Yeah, so I can begin, and we are continuing to look at our local measures. So we do have a number of local policies and bylaws still in place, our masking bylaw being one of those. At this point, we're not making any changes to those bylaws and to those provisions, so the masking bylaw does remain in effect. But of course, as we see those changes and announcements coming through from the province, that's something we'll continue to look at. But for now, our local bylaws are still remaining in place.
Perhaps I'll just add, to this piece around the provincial work that's being done, looking at masking. They are looking at reviewing the evidence. Where does it say at this point, and how it can help us as we go forward. You've heard Dr. Moore talk about, as you said, Lisa, potentially lifting this over the next month or so, based on what that evidence review shows and what it shows as we open back up, but also looking at how these masks might fit in the longer term as well. And as we look at the fall, and depending on what might happen with the respiratory viruses over time, might it be something that's revisited then as well? So very much it's a pretty dynamic environment right now around masking, how it best will work for us when it comes to COVID-19, how it will work in terms of respiratory viruses as we go forward, and where it'll sit with public policy. So be something to very much watch over the coming weeks.
Okay, thanks.
Have anything to add to that, Lisa? I think you asked all of us, but I fully support the, I'd like nothing more than to have all of these restrictions gone, but we don't want to throw away 2 years of effort to protect people in our community. And I think my guess is that masking will be with us for a while, but certainly committed to ensuring that we continue to follow the public health guidelines to keep people as safe as we can make them. And knowing that there are still, increasing cases very much putting pressure on the hospital system, that continues to be a concern. And that's is certainly cause for looking at some of these measures to continue for a period of time.
Okay, thanks. And sorry to interrupt there. Just wondering, this is a little more specific for Dr. Richardson. If the mask mandate is lifted in schools on a provincial level, is there any, I don't know if it's within your power to kind of implement something locally, if you are concerned about maybe our youth vaccination rates are a little lower than the provincial ones, or maybe we have higher concentration of COVID cases. Is there anything that local public health can do if the province decides to lift it on in schools?
Thanks, Lisa. So certainly there is that ability for any of the local public health agencies, Hamilton included, to institute measures if they see something that's different from what is being seen in other areas of the province and the overall provincial direction, whether that's in schools or elsewhere in the community as we move forward. So at this point, we'll continue to follow, what it is, where the evidence is sitting, work with the province around these pieces. We'll continue to look at our own transmission rates, just as you said, the factors that are happening here in our schools. At this point, we don't see anything significantly different from the rest of the province on any of those fronts. And so we'll continue to follow and see where we're at as each of these decisions get made, but would anticipate, given the current trajectory, we'll probably not need to put anything further in place. But as I said, that's always a matter of monitoring the indicators as we go.
Great, thank you, Dr. Richardson. Next question is to Bobby from CBC Hamilton. Bobby, you can go ahead.
Hello, everybody. I hope you had a pleasant weekend. I had a milkshake yesterday. It was delicious. My first question is for the mayor. I heard you say earlier that city staff will still have to provide proof of vaccination. What would it take for you to prompt a review or change to that policy?
We're committed to maintaining a safe and healthy workplace. That's a standard I think that we cannot throw away. So I think that requirement for vaccine verification will remain for employees for the moment. I don't foresee any change. I think we'll see how this plays out province wide, and possibly what other municipalities are prepared to do. But I would think that given that so many of our staff have done the right thing by getting vaccinated as required, and that a healthy and safe work environment is still very much a responsibility for our corporate entity, that that vaccine verification process may very well continue. So I don't have I don't know that we've made a decision on that one way or the other, but my personal expectation would be that for those that have not yet vaccinated or have not indicated their vaccination status, that they are still required to do so.
Thank you. And my second question is for Dr. Richardson and the mayor again. Sorry for leaving you out of this one, Jason. Feel free to pitch in if you want. But my question is just some of the demonstrations that we've seen in the city, in Ottawa, other cities, seems to signify that there is maybe a lack of public confidence in our government and our public health response to COVID. And there was even a recent McMaster study that seemed to indicate that people aren't feeling very confident or optimistic about how we've approached things. What are we doing to try to improve that? Because this pandemic has stretched on for a long time, and I think people are getting a little restless and are struggling to remain optimistic.
Mr. Mayor, would you like to start, or shall I?
Well, you go right ahead.
All right. So it's, very understandable. We've been at this for 2 years, and it's been a series of ups and downs when it comes to COVID-19 and us trying to understand the best ways to manage it. And I think we've done remarkably well here in Ontario. And that means that the people of Ontario, the people of Hamilton have done remarkably well in terms of the measures that have been put in place, the ability to, get vaccinated, do the things that need to be done. But that doesn't mean it hasn't been incredibly frustrating. It hasn't been incredibly wearing on our lives, on our mental health, on all sorts of aspects, economically, many other ways as we've gone through this. And so I tend to see this mostly as an expression of frustration and desire to get on to living in ways that we were before, rather than continuing on with the measures. And so I think to hear, people speaking to those things is not surprising whatsoever. Mainly as we go forward, we need to continue to look at, I think transparency has been absolutely key in terms of, what's happening here, having people understand where things are at, what does the evidence show. We're very fortunate to have the science advisory table that gives us that overview from across a number of academic leaders. Our measures that are being used are very transparent, so people understand where the concerns are, what is happening, and what it might be that would take us down another course. Certainly we know that these measures have been effective. We see that. We'll continue to see that in the science, or we do continue to see it in the science that's being done and followed up to see that they've had an impact. And we're being very thoughtful as we reopen, understanding that we want to reopen as soon as it's safe and we're able to do that. And some people find that a little risky on the other side, Bobby, in terms of, are we moving too fast? Are we doing too much? And I think that's the balance that we're each going to have to figure out as we go forward. We're trying to get better and better. And through what we usually see with pandemics is you go through this transition now with different waves will continue to come forward. We'll continue to move through this, but we'll get better and better at understanding, predicting, knowing what works. We've got now vaccines, now treatments, all those different measures in our toolbox, which will make a significant difference. And so we'll get better at understanding what it means to live with COVID-19 and move forward through it. Mr. Mayor?
So, Bobby, I kind of question your premise, because I think we're all frustrated by this virus and the vaccine and everything that we've had to do. I think that's been a common thread. So asking people whether or not they're frustrated, I think that's a pretty easy answer. I think that you probably get 100%. But I think the vast majority of our population also understands what needs to be done and have been doing it. And so, a small vocal, group of or folks that don't appreciate the mandates are certainly making a lot of noise and speaking up very loudly. But I don't think that represents the majority of our population, certainly not the people that I talk to in our broader community. As we're able to get out more in our community, you get to hear some very solid appreciation of the efforts that not only public health and the governments have been taking, but that individuals in our community have been responsible for and have done an excellent job of getting us through this pandemic. So your premise is that a lot of people are frustrated. Totally agree. I share that frustration. I'm sure the doctor shares the frustration, and Jason and everyone in the administration that have been working hard on this, as well as the vast majority of our population. But I think the commitment to getting done what needs to get done to get past this, I think that has been demonstrated over and over again throughout these past 2.5 years. So I think I'm pretty confident that the community will continue, by and large, to follow the public health advice that they're getting.
Great, thank you, Mr. Mayor. Our next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the questions. I hope everyone had a great weekend. This one is for Dr. Richardson. Dr. Richardson, active cases are still listed as being very high in numbers, and they haven't been seeming to go down quite as much maybe as we would have expected. I'm just looking to find out what's going on there. Like, how is that calculated, and is that being calculated like normal, and how accurate is that number?
Thanks, Joanna. Just you cut out a little bit there. You're talking about the active cases on the dashboard?
Yes, the active cases on the dashboard, they're still sitting at somewhere between 6,000 and 7,000. I know they were up well 10,000, so it has gone down. It just hasn't, it's just been sitting sort of between that 6,000 and 7,000 for quite some time now.
Right. And so as we look at those numbers, there's a few things to take into account. So we do have all of the PCR tests that come through are being followed up, most of them now by the provincial workforce, and we focus in on those that are related to the highest risk settings only. And so we're not doing the case and contact management, which would have closed those cases off as soon as we were able to do that. And so that's probably contributing some of that to some of that. So we're only doing that for those highest risk cases. And so you point out a good piece is we're going to need to look at those numbers and determine how we manage the active case piece as we go forward, given that that's not something that we're doing. Really, we're focusing more on the number of new cases that we have, knowing now that it's a different subset that we're looking at than we were in prior days, because we're just looking at those who are eligible for PCR testing, but we are still tracking those numbers along with other numbers like the number of outbreaks, all the ones you heard me talk about before, and really focusing more in on those severity indicators rather than the case indicators.
Thanks so much. And my next question, I think, would also be for you, Dr. Richardson, although I chime in. I think there has been a lot of divided feelings over vaccine passports and workplace vaccine mandates coming to an end. And, some are really questioning that. So I'm looking to find out, Dr. Richardson, what is your opinion? Like, is it time to drop these? What is your opinion on that?
Yeah, thanks, Joanna. And of course, welcome Jason's and the Mayor's comments as well. When it comes to the vaccine passports, and when we look at public health measures overall, we need to use the measures that we need to use in order to reduce disease transmission, to bring case numbers down, to protect our healthcare system. And then we also need to be very careful about, not using measures when it looks like we have good control. And so just as we talked about recently, just about the mask today, we're looking at all of those measures. And you heard from Dr. Moore, he's looking at the requirement around vaccines, that be lifted as we go forward. I think as we do go forward, we still suggest that organizations continue to look at how does immunization fit into their overall health and safety approach within their organization for the staff that work there and for the clients that they serve. And so that's something we recommend for all vaccines. We do it with other vaccines in all healthcare settings. So it's not unusual for us. In parts of our economy, parts of our work world, but in others it may be something new and different that they're looking at as they move forward. So looking at how does vaccination fit into their health and safety needs, and how do they continue to promote vaccination as they go forward, knowing the impact it has on the workers themselves or the people who are in, and how it affects the risks in those settings.
Great, thank you, Dr. Richardson. Next question is from Adam Atkinson from CHCH, and I will ask the question on Adam's behalf. So after March 1st, will the city or public health require businesses in Hamilton to continue checking for vaccine status for their patrons?
So I can begin, and Dr. Richardson can add if she wishes. So what the province has indicated is that they are targeting the date of March 1st to remove those vaccination requirements from local businesses. So if that is the case, then we would no longer be enforcing that from a municipal standpoint as well. Just stress again, though, that is sort of the intended date that the province has indicated. For now, those requirements do remain in place. We do continue to remind businesses that the vaccination requirement is still in place until such time as the province has announced officially what that date will be for lifting it.
So just to add, as Dr. Moore has spoken to, it's based on continuing to follow the public health indicators and see what happens over time in terms of making that change. If there's any significant change, they may elect to extend it, but hopefully we're going to continue to see rates continue to decline and see those changes. So here in Hamilton, we would be doing very much the same, continuing to watch the metrics, see what's happening, but would anticipate that we'll be continuing to do as the province does or take the lead that the province offers from the standpoint of that particular policy. There would need to be really a significantly different picture here in Hamilton versus elsewhere. And we very much see that we're following the trends of those others across the southern part of the province.
Great, thank you both. So we have a bit more time. We'll go back for one more question each. Back first to Lisa. Lisa, if you'd like another question, you can go ahead.
Thanks. Yeah, that would be great. Actually, I think this would be for Dr. Richardson, because it's kind of from the health aspect in terms of, as we near sort of not the end of the pandemic, but definitely a different phase of it at this point. We're hearing the phrase "learn to live with COVID," but there are people, people who are living with disabilities and are still a member, like they're still working and living in the community. Who have said that they feel kind of alienated by the messaging, and it's kind of like, well, I guess they're being left to kind of fend for themselves as everything else starts to kind of get back to normal. What would you say to those people who are feeling maybe that a return to normalcy kind of leaves them in a more vulnerable position?
Yeah, absolutely, Lisa. It's one of the significant concerns with COVID, as we've known from early days of the pandemic, is just how it affects those that are vulnerable in our communities. And we've seen that those challenges raised time and again, whether it's in actual experience from a disease control standpoint and people becoming sick, or whether it's around access to vaccines. And so as we go forward, those are issues that we need to continue to be mindful of. And so when we talk about doing our own personal risk assessment, there are going to be those that are at higher risk and are going to need to take, additional measures as we go forward. There's also things we need to do as a system to support people who find themselves in those ways. You'll know that Ministry of Long-Term Care, when it comes to those who are living in long-term care homes, are very much looking at how they move forward and balance the risks in those settings. We're seeing that across congregate settings as a whole, knowing that often vulnerable people live in those settings, but also in our community. How do we move forward? How do we understand the risks and balance the risks? And so I think we're going to see people understanding the suite of measures that they have available to them, or to those who may come into their home or into their organization, and making decisions about how best to balance those risks on an individual basis and on a settings basis or organization basis.
Great, thank you, Dr. Richardson. We'll go back to Bobby from CBC Hamilton. Bobby, if you'd like another question, you can go ahead.
I'd love another question. My question is regarding, is for Dr. Richardson, just regarding some the booster rates, the third dose rates. They obviously aren't the same level as our first and second doses, but right about after the 65 to 69 age group, everyone beneath that seems to be kind of lower. And I mean, do you have any sort of projections about when those might catch up? Because I mean, they do seem low, like 50%. I realize that over time, more and more groups are being eligible, but they just don't seem that high. They didn't seem to have caught up as quick as the other first and second doses did. So is there some fatigue there? Do you have a sense of why they're that low and when we're going to start to see those rise a bit more?
Yeah, Bobby, these are good questions in terms of how long will vaccinations take, and very much top of mind as we plan and go forward, wanting to make sure that people have that opportunity to get vaccinated when they elect to do so. And so I think there's a few factors, just as we've talked about all the way through the vaccination campaigns. It's a complicated decision around whether or not to get vaccinated, and people need to move through it on their own, make sure they have the information they need, take into account their own personal circumstances from a health perspective in terms of what their needs are, talk with them talk with people, their family doctors, their healthcare practitioners who are involved. If they have a specialist who's involved, ask good questions. And, you know, we have our sick kids, a phone line for parents, for example, that can support them in getting information and going through that decision making. And so it does take time. We know too, people have a lot of other things on their mind, especially as we're stressed and have been. The mental health impacts of the pandemic increases that level of stress and challenges in terms of moving through those decisions or just trying to make ends meet as we've seen costs continue to rise. So we know that there's a lot of things that go into that and contribute to the time. And of course, on top of that, you have that timing piece about, you know, the 3 months now between our second and third dose for most, but as well the 6 months now for the 12 to 17-year-olds in terms of the timing for their third dose. So I think that makes it a little bit more complicated in terms of when people understand that they're eligible. And so trying to sort all that through, make decisions, and then if the timelines are longer, that does mean that it will take more time for people to get those vaccine rates up. So I think it's a combination of all those factors, but just really points for us in public health and our healthcare partners about how we need to provide as many flexible ways for people to access that vaccine when they can, where they can, and where they feel comfortable doing so.
Thank you.
Thank you, Dr. Richardson. We'll go back to Joanna from the Hamilton Spectator. You can go ahead.
Hi, thank you for the extra question. I think this would be for the mayor. Is there any concern that Dr. Kieran Moore dropping the workplace vaccination policies will cause issues for you as you try to bring in mandatory vaccination on May 31st? Like, for example, Hamilton Police won't have a workplace vaccination policy at all, while, you know, the rest of the city has a mandatory vaccination policy.
It is a concern, and certainly that is something that every organization is going to have to grapple with in their own way in terms of determining whether they're going to follow through with their vaccine verification policy. I know the hospitals are continuing to follow through, as I understand it, and I believe many companies in the community would likely also do the same. And you know, as I said earlier, I believe the city should follow through with their vaccine verification policy. We have 97% of individuals in our employ that have done the right thing and have verified their vaccination status. And you know, I think that that is going to be important going forward. Again, I think a healthy and safe environment that we are responsible to provide is something that we cannot ignore. And I believe that, you know, we may see challenges through either unionized forces. We have seen some challenges come forward, but I expect there may be more. And we'll have to weigh the decisions in terms of how we're going to deal with that as we go forward. So it's going to be, none of it's been easy. I think, you know, putting the requirement in place was not an easy decision either. And so, you know, reviewing whether or not we continue on with that, I think the likelihood is pretty high that we will. But that's something that is yet to be looked at, and we'll certainly come to terms with that over the coming weeks.
Great. Thank you, Mr. Mayor. That's the end of our media questions for today, so I will pass things back to you. Oh, Mr. Mayor is having trouble there.
I'll get it sorted out. There we go. Yeah.
Awesome.
Thank you, Jasmine. I had multiple screens going on here, and it definitely messed me up. Thank you, Jasmine. Thank you, Bill Custers and the entire team at Cable 14 and Clear Cable. And of course, to our media partners to join us each and every time for this briefing to help ensure that important information is shared with our community at large. And for more information on COVID-19 and the financial supports and any updates, visit our website at hamilton.ca/coronavirus. So please continue to follow all public health measures and get your vaccine. Residents can find the latest information on the city's website at hamilton.ca/coronavirus or by following us on social media. So that is all for today. Thank you all for joining in, and we'll see you at our next media briefing Monday, March the 7th at 3 p.m. In the meantime, have a great week, and we'll talk to you soon. Thank you.